let's talk about something that is a true medical emergency. Imagine one of your joints, a knee, a hip, as this perfectly sealed, sterile fortress. Now imagine an invading army breaches those walls. Well, that's exactly what septic arthritis is. It's when bacteria get inside a joint, and trust me, the battle for your mobility begins in an instant. So, what actually happens when that sterile seal gets broken? This isn't just some minor infection, it's a full-blown crisis. Inside that joint capsule, a war erupts, and literally every single hour counts. Alright, so first up, let's get into the enemy's tactics. How in the world does a fortress like a joint even get compromised in the first place? Okay, the key term you need to know here is pyogenic. It's a bit of a medical-sounding word, but it just means pus-producing. So we're not talking about simple inflammation here. This is a complete bacterial takeover, and it turns the delicate, lubricated machinery of your joint into a toxic battleground. And who's the main bad guy in this story? Well, it's a name you've probably heard before, Staphylococcus aureus. You know it as staph. It lives on our skin, totally harmless most of the time. But get it inside the sterile environment of a joint, it becomes a seriously destructive force. So how do these invaders actually breach the walls? Well, as you can see, they've got three main routes. The most common way is for them to travel through the bloodstream, kind of like a Trojan horse coming from an infection somewhere else in your body. They can also launch a direct assault, right through a wound or during a surgery. Or they can invade from a neighboring territory, like an infection in a nearby bone. Three different pathways, but they all lead to one devastating outcome. Okay, so the invasion is on. How does the body sound the alarm? Let's take a look at the red flags you absolutely have to know about. The body's alarm system is, well, deafening. We're talking a high fever, a racing heart. And at the joint itself, which is usually the knee, the pain is just excruciating. There's swelling, there's redness. It gets so severe that putting any weight on it at all becomes impossible. It's like a total shutdown of that limb. And here's a really fascinating clue. Your body, in its own kind of wisdom, tries to relieve the immense pressure inside that joint. So it instinctively moves the joint into what's called a position of ease. You know, like a slightly bent knee or a hip held just so. This subtle, involuntary shift is a huge red flag for doctors. So with all these alarms blaring, it is an absolute race against time. This is a medical emergency, no question. So how do doctors fight back? The counterattack has to be swift and decisive. First, they do a joint aspiration. That's where they draw fluid directly from the joint to confirm the enemy is actually there. Then, it's a full-on, two-pronged assault. Surgery to physically flush out the joint, combined with a powerful barrage of IV antibiotics to kill the infection from the inside out. But you know, even after the battle is won and the infection is cleared, the war isn't necessarily over. The aftermath can be devastating, sometimes with consequences that can last a lifetime. This chart really lays out the grim possibilities. I mean, best case scenario? A full recovery. Fantastic. But any delay in treatment can lead to something called fibrous ankylosis. That's where the joint just gets choked with stiff scar tissue and movement becomes really limited. Even worse is bony ankylosis, where the bones literally fuse together, locking the joint solid forever. And in the most tragic cases, you're looking at complete destruction of the joint and permanent deformity. And just listen to this quote because it really captures the horror of what can happen in infants. The head of the femur, the big leg bone, is still soft cartilage at that age, and it is, and I'm quoting here, rapidly and completely destroyed by the pyogenic process. It's just a chilling reminder of how high the stakes are. This absolute nightmare scenario actually has a name, Tom Smith arthritis. It's a brutal form of septic arthritis that happens in infants' hips, and it really serves as the ultimate cautionary tale here. And you know, the truly cruel part is just how insidious it can be. Think about it. An infant can't tell you their hip is on fire, right? So the infection just rages, often completely unnoticed, until much later, when the child starts to walk with a limp, a permanent, visible sign of the damage that has already been